This is why I love live events, because I get to feed off your energy and you guys get to feed off mine, and we exchange this, and this is an exchange of light. So today I'm here to talk about quantum dentistry, which has got absolutely no clinical and scientific backing whatsoever. And basically I'm trying to put the mouth back into health, but in a bit of an abstract way, because most of the dentists that talk about holistic dentistry, and they're talking about, by the way, Max, I'm probably going to go over time here, so I apologize. We're talking about oral microbiome, we're talking about taking out metal fillings, we're talking about root canals being bad, and there's merit to all of that, but there's one key aspect about how the mouth can influence health which is completely ignored, unintentionally, and so I want to shed light on that today. I really wanted to start to just talk about how your body actually works. And so your body is a quantum thermodynamic system, and it takes inputs and signals from your environment, channels that down to your cells via the fascia, and then your cells know what to do with that information, and that drives metabolism, that drives time inside your body. Fundamentally, that's how we work. All of these inputs are resonances that are delivered via light and sound. And we use these surfaces like the eyes, the skin, the gut, the respiratory system to receive these signals. Now, a quantum system is fundamentally non-linear, so what goes in doesn't necessarily come out the same way. It can be amplified. So, for instance, one photon, when it hits the retina, actually gets amplified 1 million-fold. And that information, that amplified signal, is how we're able to make so much sense from the light that we receive. Now, here's a cool fact. 38% of the brain receives sensory information from the mouth and associated facial structures. That's how important the mouth is in the information that your brain is receiving. And so quantum dentistry, in my mind, is appreciating this non-linear aspect to our quantum thermodynamic system and trying to work out how small inputs via the mouth can deliver an amplified signal to the brain. And so, in addition to all of that I've just said about the quantum thermodynamic system, how does it work? How are the resonances passed down via the fascia? But a key aspect as well is semiconductors. And so most of the proteins in your body, DNA, water, these are all semiconductors that are conducting this information through the strata of your body, through the different levels, in order to drive circadian rhythm, metabolism, energy production, and signaling. And all of that really does is help us make order from chaos. And so what we've got on the top right there is energy flow, but energy that's just flowing through us without any order just ends up going nowhere. And we have these periodicities, or these cycles that develop from the information that we take in, and we're able to channel those energies into periods, kind of like a 24-hour clock. And so we've got different periodicities in our system. We've got 24-hour cycles, we've got infradian cycles like the menstrual cycle, the 28-day cycle. We've got hormone cycles, which men suffer from as well, guys. And we've got a multitude of cycles that are coupled together into chaos. So fundamentally, your body looks like that image on the right there. All of these cycles which are layered on top of each other that are actually then working coherently to create what health looks like, which for me is a flow state. Einstein said that what we have called matter is energy, whose vibration has been so lowered as to be perceptible to the senses. There is no matter, there is only light and sound. So where does the resonance take center stage? It takes center stage in water. Water is kind of like the stage upon which light, resonance, and sound dances upon. Albert St. Georgi, one of my favorites, he was known to have said that life is water dancing to the tune of solids. So fascia really is where the water is stored inside of our bodies. And we have water as this key non-visual photoreceptor that's not just receiving light that we can see, but also receiving the light that we can't see, infrared light and UV light, and that's a key signal for us. Many of you will be familiar with the work of Gerald Pollack. I'm not going to elaborate too much on it, but he talks about how water inside of our body is not kind of like a liquid water like the water that we drink. Most of the water inside of our body has structure to it, and that structure is imparted into the water via infrared light and via UV light. But here's a cool thought. Water has memory. And this is a paper that explores how this concept of water having memory dates back to the 1980s, although one could argue the ancients knew about this but never documented it thousands of years ago. This is one of my random thoughts which I share on socials every now and then, but the history of everything that has ever happened on Earth is stored in water. Water has memory, and the memory is held in the hydrogen bond network that bonds water molecules together to create this structure. Water is the original decentralized time chain of planet Earth. So it's the hydrogen bonds between the water molecules in structured water and between the exclusion zone sheets that is where the memory is stored. So what I'm trying to say is that, paint this picture that you are your greatest healer. The answers for your health on a healing journey are already stored inside of you. You just have to work out ways to access them. So what are some of the things that water stores? Environmental information, which I've touched on, light and sound, traumas, emotional traumas. But the other thing that water stores is an inherent healing capacity. So what has all this got to do with dentistry? Because I've yet to really talk about teeth, but I'll come to that later. A lot of my consultations, the last thing I do is look inside the mouth. So I'm going to try and mimic that today, and one of the last things we'll talk about is the mouth. But we have an epidemic of small jaws, and if anyone wants any evidence for that, just ask yourself, how many people do you know have had braces or Invisalign, and how many need braces or Invisalign? And so the question is, why do we have these small jaws? And there's lots of merit to, like, we're not using our bodies the way that we used to. We're spending limited time in nature when we're growing up. We've got children who are not necessarily eating chewy foods as they're growing up. They're eating purees. Children that are growing up with nasal obstruction. And so that when the noses are blocked, the tongue can't press up against the roof of the mouth in order to drive that development because the tongue's hanging down for mouth breathing. We've got very easy for me to say, and I acknowledge this is a sensitive topic, but there are some children that are not being breastfed or not being breastfed for long enough, though I do acknowledge the challenges around breastfeeding. But there is another really important reason which is often ignored. Are dentists actually thinking about what the jaws are attached to? What a random question. But fundamentally, dentists are not thinking that the mouth is actually attached to the head. So what do we have? This cranio-sacral mechanism is absolutely pivotal to your health. And I have some of my patients in the room today who can certainly vouch for that. And what it fundamentally means is that we've got this system of bones in our head and our tailbone, our sacrum here, and they're moving rhythmically. They're moving in sync with each other. And what that does is it helps to pump cerebrospinal fluid up and down our spine. But it also helps to drain lymph out of the head. So that, I mean, in 2016, they discovered that the brain had a lymphatic system. It doesn't mean it wasn't there before. So it's been there for all time. It's just that, because centralized medicine picked up on it now, so now all of a sudden it's important. But we have in our head this really key junction between two bones, the sphenoid bone, which is the one in green, and the occipital bone, which is just behind it. And that junction is called the SBJ, sphenobasilar junction, or sphenobasilar synchondrosis. And those two bones, they actually flex and extend against each other. And that is the key pumping mechanism that pumps cerebrospinal fluid up and down your spine. Now we have the head, which is attached to the tailbone physically via something called the dura mater, which literally means tough mother. And the dura mater is this really thin, tight membrane that connects from the top of the head all the way down to your tailbone. So when you have a knock to the head or when you have a knock to the tailbone, there's reverberations that are sent up through the dura mater or down through the dura mater to the tail end. And this impacts cerebrospinal flow being pumped. The other key aspect of the craniosacral mechanism is this concept of parasympathetic outflow. Like we're all having an adrenaline rush or a cortisol rush with life and kids and work and, inflation, thanks to central banks and all these sorts of stuff. And so how do we calm down? Well, all the nerves that come out of our central nervous system to calm us down come out via the cranium and via the sacrum. So it's absolutely crucial that if we want to get on top of, if we want to be able to meditate, if we want to be able to calm down and align ourselves and center ourselves, that we do actually need to have an optimally functioning craniosacral mechanism. So a little bit more about the sphenobasilar junction. I just wanted to put up another slide there just to show how they rotate against each other, these two bones. Have a look at these. Have a look at these bones move, guys. This is happening in you right now. Mainstream medicine will tell you that once you finish growing, that these are all fused together, but nothing could be further from the truth. Isn't that just beautiful? That's happening inside of you right now. You know what? We'll watch it again. It was so cool. This is called breathing. This is the breathing that happens before carbon dioxide and oxygen. This is primary breathing, because breathing is motion. And this happened inside of you when you were in your mother's womb. So how does the face grow? Because we've got an epidemic of small jaws. That creates the crowded teeth. But what's stopping that growth from happening? If you look at this diagram on the right, the face grows downwards and forwards out of the head. And the plus signs here, I like my maths, but the plus signs demonstrate that actually when the face is growing forward, the bone isn't being laid on the front of the face. The bone is actually being laid on the back of the face. Does that make sense, guys? All right. And so what's creating that backwards laying down or deposition of bone is the pumping mechanism of the sphenobasilar junction. It is the movement of your cranial bones. And your face can't grow forward if the cranium is all jammed up. It's all locked up. The face has just got no signal from behind to make it grow forward. So what can disrupt the craniosacral mechanism? It can be lots of things. It can be birth traumas. It can be emergency C-sections. It can be baby being born with a cord around their neck. It can be using a forceps or a vacuum to deliver baby. It could be sports. It could be concussions. It could be playing cricket, playing against a fast bowler, not wearing a helmet, getting smacked in the side of the head. Motor vehicle accidents. Sadly, it could be, physical sexual traumas as well. And all of this leads to breathing difficulties. So now let's talk about teeth. What I believe, is that crowded teeth are merely a reflection of the cranium behind. Much like you have a projector up here projecting onto the screen, that's the cranium and that's the teeth. The teeth are just a sign of what's going on behind. And so I believe that the cranium drives the positioning of the teeth. See, the body doesn't make mistakes. It knows what to do. It intentionally places teeth in weird and wonderful positions to help you walk, to help you breathe, to help you function. And if those teeth aren't in that position, then the body can't survive. So one of the main points about today is that crowded teeth are not a mistake. They're a functional compensation. They don't look good, but they work. And so what I like to call that is a functional misalignment. Misalignments don't look good, but it's functional. And what we do in my profession is we take that functional misalignment and we turn it into a dysfunctional alignment. It looks damn good, but it doesn't work. And so then the cranium's like, what did you do that for? I needed the teeth over here, but you moved them over here. And that person then starts to suffer with pain. They start to suffer with TMJ issues, or neck issues, or their C1 keeps on slipping out of position, or they get a left hip pain, etc. And this is stuff which I see time and time again. And so the cranium's like, all right, to avoid that from happening, what I'm going to do is I'm going to move the teeth back. You thought you were smart, I'm going to move the teeth back, and then everything's going to be hunky-dory. That's what we call orthodontic relapse. So then dentists got really smart. We're like, all right, let's just bolt that in. And once we bolt that in, now the teeth can't move. So the body's like, well, if you're not going to let me move the teeth back to where I needed them to move, then something else has got to give. And so that's when you're signing up people for a lifetime of pain in other parts of the body, because the head can't use the teeth to compensate now. So now we've got other structures inside the body that are being sacrificed in order for that person to function. And so there's a book that was written by an OG dentist probably 50 years ago, and he called it dental distress syndrome. And, you know, most of my clinical practice is dealing with dental distress syndrome. It's a real thing. It makes me feel relevant in health. So we are signing up patients for a lifetime of suffering just because we are ignoring the way that the body actually works at a postural level. So here's an example. I mean, this is a patient that came to see me. And I mean, I've covered up a part of the face just for privacy reasons. Please don't take photos and videos of this if that's okay. But just to paint the picture, like her left eye is significantly higher than her right eye. So is her left ear. And her right eye is a lot more turned in compared to her left eye. And these are all telling me signs of what's going on in the head. It's like I start to map the cranium purely by looking at the face. I've already mapped most of you already. So we have this concept in dentistry. If we look at the photo on the right, okay, we've got 6 teeth at the front, and then I put a gap there, but there is actually a tooth that usually sits there. And because this person had crowding, those 2 teeth were taken out and the front teeth were wrapped back into her mouth. Can you see how they've been pulled down? And so the same happens in the lower jaw. Does that all make sense? Who here has had teeth out for braces? That's what's happened to you. And what happens is when you have the upper teeth that are wrapped back, then the lower jaw has to tuck in behind it. And so you see she's got a retruded lower jaw. Now you look at her x-ray and her airway there is minuscule. It's like a straw. She needs a much bigger airway. She's finding it hard just to breathe. Breathing is central to life. And so she starts to posture her head forward in order to get the tongue off the airway so that she can breathe. But then she sacrifices her cervical spine. These are all the necessary compensations that the body does just to help people, that the body does just so people can survive. She can't open her mouth wide, 37 and a half millimeters. Should be at least 50. This is a grown woman. Her tongue is not happy. Can you see her airway behind that tongue when she opens her mouth and pokes her tongue out? You should be able to. You know what's crazy about this? Is that her tongue is so trapped in this small mouth, it's pressing forward so much. You can see the indentation of the lower front teeth against her tongue. Who here has heard of cranial nerves? How many are there? 12. Did you know that 5 of the 12 cranial nerves have some sort of innervation into the tongue? Can a central nervous system be happy if the tongue doesn't have the space that it needs? So we've got another scenario here of like teeth angling into the center. Can you see these back teeth angling into the center here? They're tipping towards the tongue. The tongue's been pushed up. It's just got no space to go. And we've got an indentation of the back teeth against the side of the tongue. It's literally an imprint of the teeth. So we call that tongue scalloping. And that doesn't look like a nice dental arch, does it? Here we have, I love this photo because it's a beautiful representation of how the asymmetries can can be on from one side of the mouth to the other. This tipping towards the tongue is way more pronounced on this person's left side compared to the right. And this is a sign of what's actually going on at the back of the head. The mouth is mirroring the head. This is a nice arch, would you agree? Nice spacing between the upper front teeth. Massive jaw, yes? Come on, guys, I'm not trying to be funny here. Let's give me a yes. But if you look at it closely here, see how his upper back teeth are biting on the inside of his lower back teeth? It should be the reverse. So despite that being a beautiful arch, that mouth is too small for him. And so for someone that's 5'2", like me, that's perfect. But for someone that's 6'3", like Simon, that's not enough. Here's the facial scoliosis. See the bend in the cranium? If we look at her TMJs, which are the jaw joints just in front of the ear, look at how different her right one looks compared to her left one. And look at the angulation of the left one compared to the angulation of the right one. Completely different angles. This is like a distortion in the cranium. So the punchline is this. There's a focus on an orthodontic alignment of teeth without attention being paid to the alignment of the cranial bones. And this is a mismanagement because it's affecting the cranio-sacral mechanism. It affects the posture, it affects the fascia and the associated water, and it impacts the ability of the water inside of our body to transport these environmental cues that we've been receiving from the sun, from grounding, etc. So the paradigm shift is that I want to straighten teeth in a body that's straight as well. I don't just want the picture to look good, I want the frame to look straight as well. So I actually work alongside a cranial osteopath who helps me align the body while I'm aligning the mouth and the jaw bones. And so we get this beautiful kind of harmony between the mouth and the rest of the body. This is flawless though. These guys, they don't need any treatment. So could the mouth be actually, I've spoken a lot about how the mouth is impacted by the cranium, but could the mouth itself be used to help the cranium? So there's this, let's talk a little bit about posture now. We've got like all these imbalances throughout our body. We've got the liver on the right side, we've got the heart on the left side, we've got 3 lobes in our right lung, we've got 2 lobes in our left lung. There's all these imbalances which come together to form balance inside of our body. And part of us creating that balance is we've got postural sensors that are allowing us to see as hunter-gatherers when we're running after a deer or something to be able to spear it. We've got the eyes that are facing the horizon and being able to sense that. We've got the vestibular system in our ears. We've got our feet which are firm, flat on the ground, sensing the horizontal. But there's actually one other really important postural sensor, and that's teeth. Because the teeth, when they bite together, are in a horizontal plane. The teeth actually, when they bite together, tell the head how to sit on the spine. And that's the most commonly ignored aspect to postural health. If there's any chiros out there, there's one by the name of Michael in here. So what does the mouth have to offer the system? We've got chewing, we've got phonetics, we've got breathing, swallowing, proprioception, balance, support of the cranium and the cervical spine, but the creation of force is a really key one. So I want to talk a little bit about something called a closed chain contact. When our foot hits the floor while we're running, the arch of our foot actually receives the force from the earth. You can't step through the floor. The floor is hard. And so all of that force that happens when you're stepping through onto the floor, hunting, that is absorbed by the arch of your foot, of your right foot, and then that is turned into a spring force that allows you to spring off the right foot onto the left foot. Does that make sense? All right, so the key thing here is that you have an arch pressing against something hard and turning that into a spring force to allow you to spring off that arch to then land on the next foot, okay? So the spring force is really key here. It's a key take-home point. Is there any other place in the body where we have an arch? The mouth. God, have you guys watched this presentation already? All right. Well, we've got our hands when we're doing push-ups. It's the arches of our hands that enable us to do push-ups. I'm still working on the arches of my hand, which is why I can't do too many push-ups. But we've got the mouth. Okay, we've got an arch of teeth, and we have an arch of upper teeth biting against tooth enamel of the bottom teeth, which is hard. So that's one closed chain contact. And then we have the arch of the lower teeth biting up against the hard tooth enamel of the upper teeth. So we have a second arch down the bottom. And they're both creating spring forces that decompress the cranial bones. And this decompression of the cranial bones amplifies the pumping of the cerebrospinal fluid inside of our heads, inside of our central nervous system. Because when you decompress the cranium, the cranial bones move a lot better. Remember that video that I showed earlier? That happens a lot nicer when you use the mouth to create that spring force to decompress the cranium. The cranio-sacral mechanism is amplified and the cerebrospinal fluid pumps and everything's hunky-dory. So it's the cranio-sacral mechanism that I've spoken about, which is the growth and healing force of the body. We know that water holds memory. I've touched on that earlier. And it also contains healing powers, the sacred knowledge inside of us. Why are you guys here? Your souls brought you here. There was something inside the water of your body that said, I need to be here today. Okay? It's not necessarily a conscious decision. A lot of the time it's a subconscious knowing that you have to be here. There are people that have traveled interstate, even overseas to be here, because it's a knowing. So the craniosacral system houses the most important body of water inside of us, which I've already mentioned, the cerebrospinal fluid, okay? This is it's an ultrafiltrate of blood. It's predominantly water, but everything in your body, there's no scientific research to back this up. All of the knowledge that your body has on how to heal your soul, on how to connect to spirit, is housed in the cerebrospinal fluid. To me, it is the seat of the soul. And the mouth is the missing link because it can be harnessed to create that spring force, to decompress the cranium, amplify the movement of the cranial bones, and amplify the movement of the cerebrospinal fluid up and down your spine, thereby unlocking your body's ability to heal. We're going to change tack a little bit. That was most of my talk, but I want to talk about, I can't give a talk without talking a little bit about consciousness and awareness and the soul and everything. So we have a mind, body, soul complex. Many of you will agree. I believe there's 5 layers to our body. There is the physical body down the bottom. There is the physical body is literally what you can touch and feel. We have the vital body, which is your Ayurvedic chakras. It's your traditional Chinese medicine meridians. Above that, we have the mental body, which is your mind. Above that, you have the supramental body above the mind. And that is where the soul resides. And then you have the bliss body. Doesn't that just sound beautiful? Bliss body. And the bliss body is essentially consciousness or God. And what's key is your soul's ability to connect to the bliss body. So mainstream medicine will have you believe that all disease starts from the bottom and works its way up. It's a physical body problem first that then shows itself in the vital body meridians and then affects the mind and your soul, etc. And so we could call that an upwards causation. But what actually happens is that the quantum approach is that it's a downwards causation. And it's been touched on heavily. It's been a theme today, which I think is wonderful. But all disease really starts at the level of the soul. And so what injures the soul? It's societal programming. It's corporatization of agriculture and food, telling us what to eat, telling us how to live. It's traumas that we accumulate as we grow up. It's traumas that we inherit, transgenerational traumas. All of these things injure the soul and dictate the choices that we make using our mind, the mental body. And those choices are like, having meat from Woolies, having processed carbohydrates. They're conscious choices which the mind makes because the soul is injured. And changing diet, changing lifestyle, changing nutritional choices is all a sign of the soul starting to heal. So I'm a big fan of something called alchemy, and it's commonly known as this ancient wisdom about turning base metals into gold. But I've touched on this already about how really most of what we see today in modern society is an injury to the soul. And alchemy is this process of aligning the mind, body, and soul. And that's not easy because there's no drugs for that. There's no food for that. It's only inner work that allows you to align that. There's no shortcuts. You can't escape the task that you have in society or on this planet to do, and that is the process of alchemy. Once you understand that everybody, you and everybody, is here for a process of alchemy on this planet, life gets a lot easier because you just know what the game is. Now you just got to work out how to play it well. So whilst alchemy can be known as turning a base metal into gold, for me, alchemy is really about turning a leaden soul into a soul of gold. So I believe that dentistry has a key role to play in turbocharging one's journey of alchemy. And I like to call that dental alchemy. And how that is done is through using the mouth to create the spring force to decompress the cranium, to amplify the movement of the cranial bones and amplify the flow of cerebrospinal fluid, which is the seat of the soul. And when that is flowing perfectly, all of the answers are unlocked. These are some of the appliances that I use in like phase 1 treatment just to help stabilize patients, to help them kind of get to a position where they can then go and heal. And so this is the patient who I saw was sent to me by a chiropractor. She's got type 1 diabetes, which is another conversation, but she's a mother of a 6-month-old, and she had a high velocity kind of adjustment by a chiropractor, which threw her lower jaw off to the left. And she was there in permanent position. And the only way that she could realign her jaw was to press on the right side of her neck and do this weird kind of contortion-esque maneuver to realign her lower jaw. And as soon as she opened her teeth from touching, it would just slip off to the left. And that's serious. That's really serious. She was struggling to breathe. And just through phase 1 stabilization, in 1 month, we had her there. And, I love doing this work because she can be a mother now. And that's all she wanted to do. I've got a 6-month-old and I just want to be able to mother and nurse my baby. Permanent changes in phase 2 type of treatment, we use something called the ALF appliance, which looks a little bit like this. And it's quite homeopathic in nature because most dental crowding or malocclusions look like an omega-shaped dental arch, if you can make that out. And homeopathy, which is the original medicine, uses this concept of like to treat like. And so if the disease presentation is one of an omega arch, well, the alpha appliance has omega loops built inside of it, 1, 2, and 3, which are used to treat the omega-shaped arch. So it's quite a beautiful and powerful appliance. The last thing I want to talk about is this concept of kind of mechanical growth versus physiological growth, because the alpha appliance is what I would like to call a biomimetic appliance. It mimics biology. It mimics the forces that the body uses itself to grow. And what we in dentistry are doing is, we're using braces to kind of pull teeth into position. We're using expanders to make kids' mouths wider. And, mothers and fathers are turning a screw once a week, twice a week to make that upper jaw wider. And it's purely mechanical. It's purely arbitrary. When do we stop turning the screw in the expander for your child? When the dentist says, when the child says, enough, I can't handle it anymore. And we have dentists that are playing God because they're deciding how big someone's mouth should be. And they're sticking to algorithms, thinking that they're doing their patients a disservice, but what they're doing is expanding jaws too quickly so it locks up the cranial bones and actually inhibits the optimal pumping of the cerebrospinal fluid. We're setting up our kids for failure because we're affecting the flow of cerebrospinal fluid because of what we're forcing to be done in our kids' mouths. Whereas physiological growth is when you use appliances that mimic the forces that biology uses, the body decides when it's time to stop growing. The body decides how big your daughter's jaw should be, not the dentist, not you. And how can we as a profession have the audacity to think that we know how big your daughter's mouth should be? This is a collection of types of practitioners that I work with: osteopaths, chiropractors, functional neurology, behavioral optometrists. I have some staggering cases of how the eyes and wearing glasses can impact cranial bone compression, but then also the mouth and posture. Like, I'm staggered by it. Obviously, I layer on a lot of my quantum health woo-woo. Doctors, of course, you know, medicine, doctors, hospitals, they have a role to play. We badmouth them a lot, but there are some really well-intentioned doctors that are here, and we always need some sort of emergency relief sometimes. So hospitals have their place. Myofunctional therapists, which work on, tongue and lip posture, etc. Sometimes we need a surgeon to release lip ties and tongue ties, and of course, breath work. For this next part, I am showing a case, just a quick one. I've asked the parents, and they've given me permission to show the full face, but please no photos or videos. This is a boy that I saw in November last year, and his mother came to me just distraught. He's not putting on any weight. He's not eating. Whatever I feed him, eggs, meat, bread, donuts, samosas, anything. He's just not eating anything. And she's like, I know my son's physically struggling. He can't breathe through his mouth. Have a look at his neck. See how hard his neck is working to breathe. See how hard his lips are working to stay closed. This was day one. So we gave him an appliance which mimics the natural body forces, only for him to wear while he is sleeping. And my osteopath did a little bit of cranial work on him. Literally, we spent 30 minutes with him. That's all we did. And we said, come back in 30 days. And that's how he looked in 30 days. So this is unlocking the body's natural healing capacities, letting the cerebrospinal fluid do what it needs to do. Letting the cerebrospinal fluid tell the body what it needs to heal. Because we talk a lot about light and how we need to get sunlight and we need to block blue light, but you guys have no idea just how much light is stored inside of you already. You don't necessarily need sunlight every single day. You can get a big harvest for a week and then spend 2 days with not getting much sunlight, but your body has stored all that sunlight and it can release that on demand with the right cues. So we said, mate, you're killing it. Keep it up. Keep wearing the appliance. Just give you a few breathing exercises to do. And so he carried on wearing it every night. Bear in mind, he's a youngster, so he wasn't wearing it all night every night. He'd probably pop the appliance out of his mouth around midnight. So he was only getting 4 or 5 hours of sleep with the appliance in his mouth, which is a good effort because he's a youngster. All right, that's him in 90 days. Granted, he's smiling, but who wouldn't? But you can still tell. Like, look at the facial volume, look at the neck volume, this is vitality, vibrance. Now he's going to be diagnosed with ADHD. All of a sudden, he's having 3 eggs for breakfast. He's asking seconds for dinner. He started martial arts and he's already completed his level 1. And his parents are loving life. Like, who wouldn't want that for their child? Can I have a yes? Yeah. Fuck. So what I'm here to do is, plant that first brick. We have to redefine orthodontics. Orthodontics is being done incorrectly because it's just focusing on the teeth. We need to do orthopedics first. We need to align the bones first, then the teeth just fall into place perfectly. And so the orthodontic profession will fight tooth and nail to stop this message from getting out. Okay? We've seen that time and time again. All right? They've got businesses to run. They've got Mercs to drive. So the demand for change comes from you. It comes from the people demanding, I want that. Are you doing what Jalal's doing? Go and learn what he's doing because I want that. Thank you, guys.